Hi, I'm Victoria. I'm a registered nurse as well as an EMT, currently studying for my doctorate as an acute care nurse practitioner. I'm really excited to begin my nursing career in my local community hospital's emergency department located in southern Massachusetts, as well as to continue being a 4-year EMT on a small island off the coast of Cape Cod called Martha's Vineyard for their fire department. During the weekdays, I'm also a second year student at UMass Medical's Graduate School of Nursing and go Zoom University. I began my healthcare career kind of unconventionally. I was a biology major and a chemistry minor at Sally Regina University in Newport, Rhode Island. I was inspired by my father's journey with cancer to pursue some type of medical career, but I wasn't quite sure what that would look like. So during my sophomore year at Salve, I became an EMT and I worked the overnights and the weekends to realize two really important things. One, that nurses are the heroes of our healthcare system and they're the foundation for the hospitals and outpatient clinics and so forth, and I want to be a part of that. I thought they beautifully merged medicine with care for the human spirit, and that was right up my alley, taking that holistic point of view. And the other thing that I realized is that I want to specialize in some type of emergency or acute care. So that's where my dream of becoming a trauma or cardiac nurse practitioner began. So I continued my studies at UMass Medical School in their Graduate School of Nursing, where I obtained my RN license, and I'm currently practicing as a registered nurse in Massachusetts, and I'm working towards my goal as a doctorate of a acute care nurse practitioner. So hopefully cardiac ICU or trauma department one day. But the other thing that really began during my undergraduate career was I was able to take part in some research that took place in a hydroponics lab, and we were able to harvest fresh produce and fruits and vegetables, and whatever we didn't do experiments on, we ended up donating to local community centers where there were food deserts. So people who don't necessarily have access through whatever means to fresh produce, a staple of a healthy diet, we would give them produce that was grown in a sustainable way through a hydroponics garden, which actually is packed with more nutrients than conventionally grown produce. So that was what our research was on. But going with this idea, I was able in my senior year, going into my first year at UMass Med, create a community garden at a local community center in New Bedford, Massachusetts, with one of my classmates who's in PA school, and we're able to get that off the ground. And one of the things that have kind of further come to light in my time at UMass Med was that there's a direct correlation between healthy produce, reducing the incidence of chronic diseases, thus acute flare-ups. So one thing that I really, besides being a nurse practitioner in a trauma or acute care setting, I really look forward to engaging in community projects that promote healthy eating, access to fresh produce, and nutrition for the young and the old, starting with kids to the elderly. And I really think that if you put good in, you get good out. So starting with staples of a healthy diet, we're going to cut down on incidence of chronic diseases and thus acute flare-ups that I would see in my ER and so forth, or on the cardiac unit, wherever. So I really am continually passionate about that project, and that's something that I'm going to want to take with me long after I'm a provider and in the field. So that's one of the things that inspires me, is just helping people live healthy lifestyles so I don't have to see them in the ER. And, my dream is not to see somebody in the emergency department or cardiac care, and it's about staying well outside of the confines of the hospital. And I think that's something that we have to do as providers, not only do, our 40-hour week or 60-hour week job, but also be advocates for public health and community health where we live in. And that's why I feel so passionately about staying in southern Massachusetts, where I was born and raised, and caring. I think there's something so special about caring for the people who helped to raise you, and it takes a village to get you where you are today. So giving back to the community in any way is something that I'm really passionate about. And some other fun questions are my go-to pump-up song, I think, is I Lived by One Republic. I listen to that on my way to work, and I try to think of, get me in the mindset of that I'm doing all this for my patients, and it's just another work day for me, but for them it could be one of the worst days of their life. So to always be compassionate and live every day to its fullest, because you don't know what's going to come the next day, and that's why I wear a little starfish necklace too. And you can't change the world, but you can change the world for one patient. That's what the starfish story reminds me of, and that's why I wear it. So I go into my night shift with my cup of cold brew with almond milk, and I get ready to go. So congrats to everybody else out there that is enduring the COVID-19 crisis, and I wish you all well, and thank you so much for your time. Have a great night. Bye-bye.